Our region's business is sponsored by PNC for the achiever in you.
Place an order on Amazon.com and you can have it tomorrow, or maybe even today. We live in a time of increasingly instant gratification, except sometimes when it comes to healthcare. We've all been there. You or a family member is coming down with a bug or something just doesn't feel quite right. You call your doctor's office only to find out they can't see you that day. Well, now Allegheny Health Network has decided to join the on-demand world with same-day service. Kenyokee Crowell is Senior Vice President of Clinical Access, and Dr. Elie Aoun is Medical Director of Clinical Access for HN. Welcome. Good to have you both here.
Thanks for having us.
Thank you for having us.
Yeah, this is amazing. You know, it's about time, I would say. How long's medicine been around? But to get to actually same-day service is pretty remarkable. Why? What brought you? Why do it now?
So we feel the time is right for this. We feel that for patients, they want access when they need it. And every other industry out there can offer on-demand access when you want things immediately at your fingertips. And frankly, we feel that healthcare has kind of lagged behind a little bit in that. We also feel that there is no substitute for getting the care you need when you feel you need it. And nationally, most organizations struggle with long wait times for different types of appointments. So we felt this was really a way to break the mold and offer patients on-demand care and same-day access. And really proud to do it. We've been working on it for several months, and we really feel that this is a game changer in Western PA.
Well, how did a game changer within the network? This is requires changing the whole system, does it?
Oh, absolutely. It wasn't easy, I'll tell you that. We worked very closely with a variety of colleagues, getting essentially the roadmap to how to achieve the goal. But you know, it's funny, when you think about physicians, myself included, we always put the patient first. And this is where this whole idea started. Put the patient first and put yourself in their shoes. And what is it that we can do to provide better access to us, physicians, when they need us? So that's how all of this started.
Well, I just think about doctors, and the caseload is enormous. You guys go running from office to office or exam room to exam room. It seems like it never ends. How do you carve out time to make sure Dr. Aoun or one of his colleagues is available?
Well, you have to start early, and we've been working on this program for several months. We did some soft rollouts in the fall for primary care, same-day access, and then for specialty starting in January. And really, it's about looking at making sure you have inventory online in terms of appointments when you need it. So for example, if we were to take a look at a physician's schedule right now for July, and we look and that physician has 5 appointments available right now. Well, if we wait till July 15th, probably all of those will be booked. So how do we take a couple of those appointments now and reserve them for future use? So we worked through a model with our team. We had a great team working with us on this to make it happen, and really taking that inventory and those patient appointments and reserving them for future use. So that July 15th appointment, if we reserve 2 of those today, that would not come online until July 15th, making access available for a patient on that day to see that provider.
Now, really cool for the patient, but on the flip side, you want the doc to be busy. I mean, the idea, it's like putting an airplane in the air with empty seats. Yeah. So how do you make sure that the patients are going to be there in sufficient supply? How do you balance that supply and demand?
You just said it, balance supply and demand, and essentially track the initiative, be able to base your decision based on actual objective data, and see, did we reserve too little, do we need more? Did we reserve too much, do we need less? And it becomes kind of a puzzle. It's a live act of juggling those appointment slots, if you want. A little more, a little less, fine-tune the dial when it comes to it. We certainly don't want our doctors to sit down and do nothing, and we certainly don't want our doctors to be double-booked or triple-booked either. So it's a very fine balance that we have to follow.
Really is a great illustration of the intersection of IT and medicine.
Yeah,
oh my God,
it is.
The IT is the only thing that makes this possible.
Exactly,
right? Absolutely.
Exactly. And technology was so important in supporting what we did for this. And as I mentioned, we have a great team behind us that really were helping to make this live, working across the entire network. Managers and practices, physician leaders, administrative leaders, leaders in our Care Connect Access Center, all to bring it live. But what we realized through the process, there's no perfect recipe or formula. And it was really digging into the details and understanding and trying to predict the best we could what the supply and demand would be, and also understanding that it needs to be a fluid process. This is not a program you can design and put on the shelf. We've got to continue to evolve it and keep tabs on what we're doing and how we're doing in order to make sure the program's successful long term.
Only a tiny little time left, but I want to see you've been at it for about 2 weeks or so. So how's it been going? How's this whole supply and demand thing working out?
It's actually been working great. It's actually worked better than we had hoped, so we're really excited about it. We haven't had any major issues. We've had patients that were extremely happy and satisfied with the fact that they were able to get in, that they felt the need to send emails to our CEO and people high up in the organization about it. So we're very excited about it. It's been a great 10 days so far.
All right. Well, exciting to see same-day service at Allegheny Health Network. Kenyokee Crowell and Dr. Elie Aoun, thank you both so much, and congratulations.
Thank you very much.
Thank you so much for
Thanks
having us. Thank you.
Next up, a world champion poker playing computer that's powered right here in our region. Stay with us.